knew I wanted to go into medicine ever since I was young. I'm not exactly sure where I got the idea. Maybe it was talking with my grandfather who suggested it to his, 6-year-old grandchild. Or maybe it was going to the pediatrician's office with my mom and seeing how she had respect for this person who was helping take care of her children. But it's been a long time. I've known ever since I was young that I wanted to be a doctor.
I love watching Dr. Raddock with the students and the residents, and I've been so blessed to be with him for so many years. Just being the fly on the wall and watching what he does, it's kind of magical.
I think what makes Dr. Raddock so special and what makes Dr. Raddock an exceptional leader is that he really excels at what he does as a family doctor. I mean, he really embodies the mission and the principles of what it means to take care of the whole family, the whole patient, and the whole community.
He truly exemplifies what being a family physician is. The depth of his relationship with patients and their families is something that can never be matched by anyone else.
One characteristic that really sets Dr. Raddock apart from other family physicians is the fact that he is so gentle. I think that that's the bit that actually makes him a really great educator, because he will pursue everything in a little bit of gentleness, and it just really opens the door for wanting to learn and to be helped and to help others.
Dr. Raddock is a great family medicine educator because I think he really cares about teaching. He engages the residents, so I don't even know if they realize he's always teaching them, because he's like, what would you do? What do you think about this? Let's think about this together.
Education is just really one of his core values. His mom was a teacher and he grew up just being a natural teacher to our children. He's a teacher to his patients. He makes sure they understand what they're discussing.
I guess what I love most about teaching is helping someone gain knowledge that's going to allow them to help other people. It's like a ripple in a pond. There's such joy to knowing that someone has this new skill that actually they're going to go out and help hundreds of people because they have a better understanding. But more than any particular bit of knowledge, what I love is seeing them gain and develop this integrity and curiosity about forever learning. The joy of learning.
The humility that Dr. Raddock shows with the fact that he is always willing to learn and always willing to be wrong so that he can become right later is actually really refreshing and nice. A lot of our faculty are that way, and I think he's one of the leaders even amongst them. So that's a big impact that he's had on me.
As a teacher in family medicine, Michael Raddock has shown a lot of patience in the way he teaches his residents. He is an expert in motivational interviewing, and he's been very patient with residents in the way he teaches it. I've worked with a few experts in motivational interviewing before, but none of them can teach it as well as he does.
He's the person who can look at a very, very complicated situation and help you break it down into the individual parts, and does it in a way that allows you to make the right choice, but with lots of guidance and insight. It's really like his superpower, and that's what makes him such a great educator, but it really is what makes him a great family physician. It's what makes him a great colleague. It's what makes him a great friend. He's that go-to guy when things are so complicated. You need somebody to help you process it. He's the guy.
In medical school, I liked pretty much every rotation I did. I found everything interesting, but probably the thing that really helped me decide about family medicine was at UCLA, we had a clinic that was in a homeless shelter, a Salvation Army homeless shelter, and it was run and started by a family physician there. And I saw the way he could take care of children, adults, it didn't matter. He also was fluent in Spanish, and we had a lot of folks from El Salvador, Guatemala, Mexico that we were talking with. When other doctors who weren't family docs came in, they could take care of the adults or the kids, or maybe they were a specialist in GI or something, but he could take care of everyone. And I think that's what captured my imagination of the kind of doctor I wanted to be. It's kind of an old-fashioned idea, right?
I think what sets him apart is that he has so much joy in what he does. You can just tell he loves being a doctor, and I think he sets the bar pretty high for us and is a great role model in terms of not just being a good doctor, but loving your life while you do it. And I think that's something that most of us strive for.
The things that make him stand out as a family medicine educator are his ability to really be present and really listen and respond to the questions and the needs of the learner that he's working with, whether it's a student or a resident or a colleague.
He finds joy every day in what he does, and he continues to find ways to stretch and to grow, to challenge himself, to challenge the rest of us, to continually say, how can we do better? How can we be better? How can we help our patients more? How can we teach in a better way? And that's just who he is. Whatever the learner needs, he's all in, and he's going to figure out a way to make it happen.
To be good at being a family physician, you have to be comfortable with the idea that there is more to learn and more to know than you'll ever master. You have to enjoy learning new things and improvising and adjusting. You have to be a good listener, and you have to be able to listen with your heart as well as with your mind to understand all the other factors that influence someone's health and how they're making their healthcare decisions. It's hard to imagine doing something that would be more rewarding than that. My name is Dr. Michael Raddock, and I'm a proud family physician and a proud family medicine educator.